Welcome to Talking Hope, breakthrough conversations about preventing, treating, and curing cancer. Brought to you by City of Hope, an NCI-designated comprehensive cancer center. Hope lives here in Orange County.
All right, so hello and welcome to Talking Hope. My name is Darren Godden, and today our guest is Dr. Jeffrey Yoshida. Dr. Yoshida, you're the Director of Urologic Surgery at City of Hope, Orange County. And I understand that you're a pioneer in robotic surgery, having performed more than 3,000 surgeries. Is that correct?
Yeah, I stopped counting a while ago, but
I mean, that's a tremendous number for this stage in your career. That's you're amazing.
well, I owe a lot of that to City of Hope and getting into robotics really before robotics took off. So being part of City of Hope back in the early 2000s, I mean, we really just, I think we were one of the pioneers on the West Coast for that surgery, for the robotic prostatectomy. So yeah, a lot of credit goes to the institution.
Well, we're glad to have you with us as part of that. So before we jump into talking about your specialty and so forth, a lot of people talk about how cool Dr. Yoshida is. And I think that's because you're a Orange County boy right now and you're a surfer. So talk about what you like to do outside of being a doctor.
I just take advantage of living in a great area. I was just talking to another doctor before this podcast started, and he was talking about doing a staycation. He's not going to go anywhere on his time off, and it's just a great area we live. And I love to surf, and there's great surf here, and really lucky.
Yeah. You got any favorite spots?
Spending time with the family, that's time well spent.
Yeah, absolutely. Do you have any favorite spots you'd like to surf?
Pretty much anywhere in Orange County, Huntington, Newport, Dana Point, San Clemente, all great spots. I mean, we're just so blessed to have, warm water most of the time, great waves.
Awesome. Well,
yeah.
That's hopefully you have a great summer out there on the water. So the focus of our interview today and our discussion is going to be around prostate cancer. So I'm wondering, what drew you to medicine and caring for patients with cancer?
My story as it relates to going into oncology, I'll have to admit, I never really planned on oncology when I was in residency. I knew I needed to do extra training in laparoscopic surgery because that was kind of really the field that was really expanding at the time. And so I decided to do a fellowship at City of Hope. And we purchased one of the very first surgical robots, Da Vinci robots, in the Western United States about a week before my fellowship started. And fast forward a year, we were the highest volume robotic surgery center in the country and arguably top 2 or 3 in the world. And so, majority of those surgeries were prostate cancer patients. And so I had just had so much experience in treating prostate cancer patients, it just became kind of a natural field to continue on in. So I feel like it chose me. I didn't really choose it, and I feel very blessed to be in the position I'm at. Yeah.
Great. So let's dive into prostate cancer. And can you tell us what do men really need to know about prostate cancer first off?
Well, I think what I hear from men talking in the community is that the prostate cancer is not a big deal. It's slow growing. You don't have to worry about it. You're going to die with it, not die of it. And those are a lot of misconceptions. Prostate cancer is responsible for 30 to 35,000 deaths a year in this country. That's not a small number. And also with prostate cancer, it's there's a lot of pain and suffering, but it's a very preventable disease. And so, the screening that we do saves lives, and that's really important. I think how we screen has improved leaps and bounds in just the last few years. I think there's a lot of stigma behind prostate cancer screening and the biopsy process and the false positive issues related to the PSA test and so forth. And we've really come up with some new strategies, new biopsy strategies that are much more precise, and patients We use an anesthetic so they don't feel it. We've also eliminated or reduced the false positive rates associated with the PSA test because we have better screening tools. So it's something that I think, hopefully men can get past those stigmas because it's very much improved, but it could be a lifesaver. Prostate cancer is one of the most common cancers in men. And, if you get screened and if you're one of the unlucky ones that gets diagnosed with it, likely we will catch it early and we can cure you, and it can prevent all that future pain and suffering. So
that's great. That's great news. So I understand it's like 1 in 7 men will be diagnosed with prostate cancer in their lifetime. So obviously it affects a lot of us. So walk me through this. I'm a 40-something-year-old man. What signs and symptoms should I be looking for or considering? And then, if I have those signs and symptoms, what is my next step? What should I do?
Well, there are no reliable signs and symptoms of prostate cancer. If a man has symptoms related to prostate cancer, likely it's a very advanced form. So the majority of patients that are diagnosed with prostate cancer, they don't have symptoms. Now there's, enlarged prostate symptoms also start affecting men in their 50s and 60s, and that's in 70s, and that's when prostate cancer is diagnosed. So I think there's some confusion about enlarged prostate symptoms and those related to prostate cancer, but truthfully, there's really not a lot of symptoms to rely on. So for a 47-year-old, we would make recommendations on screening based on your risk profile, right? So at-risk patients should start their screening at an earlier age. So an at-risk individual would be someone who has a family history, your brother, your father. So if your brother or father have prostate cancer, your risk of developing cancer is higher than 1 out of 7. If you're African American, you're already at risk. Your risk is higher than 1 out of 7. In fact, if you're an African American plus a family member, boy, your risk is really high. So focusing on at-risk patients, probably around 45 or 50. For patients who don't have that family history or not of that at-risk ethnicity, having the discussion with your physician about the pros and cons, and maybe starting that around age 55. There aren't universally accepted guidelines, but I think that's kind of the most common recommendation.
Okay.
Yeah. And then
So you mentioned screening. Then if there's no reliable signs and symptoms, then screening is going to be important. So the age at which you start that screening might be important depending on your risk profile. You mentioned a PSA earlier. Can you tell us what that PSA is? What is PSA and what is a PSA test?
Sure. So PSA is kind of the main screening tool we use in this country and actually around the world as well. And it stands for prostate specific antigen. That's medical terminology for a protein that we can measure in the bloodstream. And the majority of that PSA or that protein comes from the prostate. So we can measure that in the bloodstream. And if a level comes back at a higher level, then that would trigger maybe some additional testing. We also recommend the prostate examination, which is also called the digital rectal exam. That's the exam of the prostate with the finger. So that's that plus the PSA is what we use to initially screen a male.
Okay. And you also mentioned maybe some other tools that are available now with screening.
Yeah. So the problem with the PSA test, and this is well known, is it's a non-specific test, but we're using it for a specific purpose. So we're using it really only to screen for prostate cancer. But there's many other factors in addition to prostate cancer that can drive that level up. So when a man's PSA is higher, that's, which one of the factors on the list, is it cancer, is it not? So we have newer tests that help look into that further. So historically, men have had biopsies, or it was recommended men have biopsies when a PSA hits a certain level. That number has changed over the years. It's been around 4, but that number has gone down to 3 in some instances. But the problem is if you just use the PSA and you biopsy men just from that level, there's a high likelihood that you could do an unnecessary biopsy. And that's what men are afraid of. That's one of the stigmas I mentioned earlier. So we have other additional tests that are non-invasive. We have urine-based tests, other blood tests. We have imaging like an MRI. And we would do that first and do a real complete, much more accurate, non-invasive risk assessment. And if a lot of these tests look okay, it's likely that you don't have cancer. And then a biopsy is not necessary. But so the PSA, I look at that as kind of an entry-level screening tool that gets patients to us. And then we go from there. But gone are the days when we're saying, oh, your PSA is at this level, you need a biopsy. We always try to do this additional testing.
Gotcha. Thank you for that. How is robotic surgery changing prostate cancer treatment?
Well, robotic surgery has been around a while. So really the big change between the traditional surgery and the robotic approach is that just men recover much more quickly. And so, with the traditional surgery, men were in the hospital for a few days. They were, not returning to normal activities or work for several weeks, sometimes even not even returning to sports or working out for a couple months. Now with robotics, we're sending patients home the same day of surgery. Men are back to work in a week and a half, 2 weeks, back to exercising and most activities within 2 to 3 weeks. So it's really just, you're back on your feet, you're back to normal life. And then the side effects of treatment improved quite a bit with the robotic technology. The main two side effects of the prostate cancer surgery, radical prostatectomy, is leakage of urine and sexual dysfunction. And with all the advantages of the robotic approach, we've really improved those side effects. So we can preserve men's ability to control their urine, preserve their sexual function much more often than with the older approach.
Great. And what other options are there to men besides surgery? How does medical oncology and radiation oncology play into this?
Yeah, so that's for a man diagnosed with prostate cancer, the most difficult decision that I've seen in patients is making the decision of, should they do surgery? Should they do some of these other things that you mentioned, radiation therapy? There's even some patients where we don't need to treat, depending on the cancer. It's a observation protocol called active surveillance, and there's even neurotreatments called focal therapies, and really, basically, it's I think for a patient having kind of a team approach with experts that know those different entities, those different types of treatments, and then having a patient have a detailed discussion with all these different experts, and having that team help a patient make that decision. There's a lot of information that goes into that decision, and I think meeting with like we do here at City of Hope, when a patient is diagnosed with prostate cancer, they'll meet with myself. I'll discuss surgery. That's my thing. I'm a surgical oncologist. And then immediately following that, they'll meet with the radiation oncologist to get information on that. And then sometimes we'll even pull in a medical oncologist where if the cancer might be more advanced or much more aggressive, we might even adopt some therapies that the medical oncologist would be involved with. But it's really this team approach and it's really being able to get patients the information they need to make that difficult decision. So it's a tricky one, but that's what we do here at City of Hope, is that team approach.
I love that. And obviously as a man, I'm glad there are options and I'm glad that we have options for our patients here at City of Hope, that there is a team approach and you do have options to choose from. Let me ask you another question about maintaining prostate health and preventing prostate cancer in the first place. So what can men do right now that helps improve their prostate health, maintain their prostate health? What can we be doing to do that?
I don't know about maintaining prostate health necessarily, but I think there are some lifestyle changes that a man can adopt that might reduce their risk of developing prostate cancer. I mean, there's been multiple lifestyle studies looking at, many, many different factors. Being a non-smoker is really important. Exercising regularly, and we're talking, 3 hours per week, that has been shown. Being of a normal weight, normal body build, in other words, not being overweight. We use something called the body mass index, and we have certain parameters, but not being overweight or obese is really key. And then there's dietary things, more of a Mediterranean or vegetarian kind of diet where you're not consuming red meats, high fats, green leafy vegetables called cruciferous vegetables, that's spinach, kale, broccoli, having daily servings in your diet. Those are all things that a man can do that could reduce the risk a little bit. Unfortunately, if somebody's got a genetic predisposition, doing all that might not make any difference at all. But I think if you're trying to control what you can control, those are things that are important.
Great. Thanks for sharing those. So what is your rooftop message, if you will, the shout out from a rooftop message that you would say to men listening to this podcast today about prostate cancer?
Yeah, I just think that the stigma around prostate cancer screening and also treatment, we've changed. Technology has significantly changed and eliminates some of those negative, ideas that some of those negative factors that men think about. We've eliminated that. So I think screening is really important. It could save your life. It could prevent a lot of pain and suffering later on in life. And the way we do the screening here at City of Hope, we really aim to minimize invasive testing. We use the latest technology, and it's a team approach. So that was a long-winded answer of rooftop message, but do the screening, and we do it differently. And I think we've eliminated a lot of the negativity surrounding that. So
thank you. Dr. Yoshida, you've given a lot of men hope, and not just men, but their families and their wives and their partners and so forth. So let me ask you this question before we come to a close. What does hope mean to you? What does the concept of hope mean to you?
What is the concept of hope? I mean, it's well, I'm looking at it when I hear the word hope or the term, I'm thinking about City of Hope. That's what comes to mind. And when we and the reason I'm here is the culture that this institution has, and what we give to patients when we first meet them, and as we take them through the whole treatment process or diagnostic process or whatever. And so it's a very caring, individualized, and really high-end team approach. So that's what I think about when I think of hope. Unfortunately, I'm a City of Hope, doctor, and when I hear that word, that's what I think of. So
no, that's awesome. We appreciate that. Well, thank you so much for being with us today, Dr. Yoshida. We know you're very busy, and we appreciate your time to talk with our patients and those listeners. And thanks for talking hope with us today. So for the rest of you, we hope you'll join us on our next episode of Talking Hope. Until next time, I'm Darren Godden. Thanks for joining us.
Thank you all for listening to Talking Hope, where breakthrough conversations about preventing, treating, and curing cancer have been brought to you by City of Hope, an NCI-designated comprehensive cancer center. This is the hope you've been waiting for. For more information, visit cityofhope.org/OC or make an appointment at any of City of Hope's 5 Orange County locations, including City of Hope Orange County Lennar Foundation Cancer Center, the most advanced cancer treatment center in Orange County. Call 888-333-4673. That's 888-333-HOPE.